So moving on to next question. Which of the following is not a diagnostic criteria of diabetes? Fasting more than 126, postprandial more than 140, postprandial more than 200, random more than 200, or A1C more than 6.5. Which is not a diagnostic criteria for diabetes? And you can answer now. So I think most of the people are on target. Moving to next question. What is the first line treatment used by you people in your clinical practice? Is it lifestyle changes alone? Is it lifestyle changes and metformin? Or is it metformin alone or a sulfonylurea alone? Or a combination of metformin, sulfonylurea or insulin or other drugs? What is the first line treatment that you use in your practice? You have to answer that. And you can answer after you see the numbers. Now, moving on to next question. What other medication would you like to add or give to almost all your diabetic patients in addition to the anti-diabetic agents? Is it ACE inhibitor, is it beta blocker, it's a statin, or it's aspirin? And you can answer after you see the numbers. Yes, now. What is the glycemic target? Coming to next question. What is the glycemic target for fasting glucose? 70 to 100, 70 to 110, 70 to 130, or 100 to 150? And you can answer now. Okay. Moving on to next question. What is the target for high glycated hemoglobin that is recommended by most of the organizations? Is it less than 7.5? Is it less than 7? It is 7 to 8, or it is 7.5 to 8.5? And you can answer once you see the numbers. Okay, you will not get an instant report on that. Fine. What glucose testing you recommend to your patients for monitoring? Fasting glucose levels, postprandial levels, fasting and postprandial both, random levels, or all of them? Next question. Gopi, we didn't have the next question? Now move to the next question, yeah. So what glucose testing you recommend to your patients for monitoring? Is it fasting or postprandial or a combination of both or random or all of them? And your time starts now. Moving on to next question. I am not discussing the answers now because we will have same questions at the end of this session. Do you advise all your patients to use a glucometer for monitoring the glycemic control? Yes, no. To all the patients on insulin only or selectively? And your time starts now. Can we move to next question? Yeah. What is the frequency of glucose monitoring or self-monitoring of blood glucose you recommend to your patients? 1 to 3 times a day, once a day, 1 to 3 times a week, once a week, 1 to 2 times a month, or depends on glycemic control. And this question does not involve the patients on insulin. This is type 2 diabetes patients on oral agents. How many of your diabetes patients, move on to next, how many of your diabetes patients are regularly monitoring glucose levels? Less than 10%, up to 25%, 25 to 50%, more than 50%. And your time starts now. So coming to the last question, what is the frequency of A1C that you recommend to your patients? Once in 3 months if glycemic control is on target, once in 6 months if glycemic control on target, once in 3 months not on target, once a year if on target, 6 months if not on target, at least once a year, or occasionally to confirm the glycemic control. And your time starts now. With this, we come to end